A burn can happen in seconds, but the right first aid can reduce further skin damage. Whether it's from hot water, fire, steam, or a hot object, do you know what to do immediately?
First step is to stop the burning is move away from the source of heat and make sure the area is safe. If clothing is on fire, stop, drop, and roll or smother the flames with a blanket if it is safe to do so. Remove hot or wet clothing and jewelry near the burn, but do not pull away anything stuck to the skin. Second is to cool the burn. Cool the burn under cool, clean running water for about 20 minutes, as soon as possible. This helps stop the burning process and can reduce pain and swelling.
Do not use ice, very cold water, butter, toothpaste, oil, or other home remedies. These can damage the skin or make the injury worse. Further, protect the burn. After cooling, gently cover the burn with a clean, non-stick dressing or sterile gauze. Do not break blisters, they help protect the injured skin. Avoid applying adhesive directly onto the burned area. Seek urgent medical attention for large or deep burns. Burns involving the face, hands, feet, genitals, major joints, or burns that go completely around an arm or a leg. Get emergency help for electrical or chemical burns, burns involving the airway, or if the person has difficulty breathing.
Remember, stop the burning. Cool with running water. Protect the injury. And never use ice or home remedies on a serious burn. Knowing these simple steps could help reduce injury and protect someone until professional medical care is available. Follow for more simple first aid tips that could save a life.